Let's sit down with Dr. David Klein of the Stages of Life Institute in Longwood. That is suffernomore.com to learn more about him. Suffernomore.com to learn more. And of course, if you want to get on a regular regimental regimen, what you want to do is sign up for stagesoflifevitamins.com. Stagesoflifevitamins.com. They'll get you your nutraceuticals when you need them on the day you need them at a 15% discount. All right. Reluctance, reluctance, reluctance. Doctor, why are we so reluctant to help ourselves?
It's an interesting question, and it's perplexed doctors for forever. Why is it? Okay, somebody is taking time off from work, taking time away from their family to come in and pay me for advice and then not take it. Or come in and argue about it, or come in and be passive aggressive. This is the worst of all, and assure the doc that you're going to do, this individual's going to follow instructions, and then they don't. You have to assume, well, a certain portion of people aren't, I don't know, maybe smart enough to understand all the language. So what you have to do is you put things in writing, and you try to get it into a transcultural communication, but that doesn't make any difference either. Okay, it has nothing to do with intelligence, it has nothing to do with the level of education, it has nothing to do with where your parents came from or where you live. It has nothing to do with that. It's more fundamental. Okay, and the fundamental reason is this, is that people don't care for themselves as much as they care for their pets or their children, for that matter. And we find parents that mistreat their kids, and we find them to be loathsome, despicable people. You'll end up with a mass murder on television. We really don't like those folks much. But if you find a parent that starved their kid, they're going to be on the TV for weeks. Truly, it's just one of those kinds of things. Despicable when you don't take care of somebody who can't take care of themselves. We really just resent it, regret it when there are people out there that don't have the wherewithal to take care of themselves or to put a roof on their head. Therefore, we will go out and take care of those folks long before we take care of ourselves. So we'll take care of our dogs and cats. You go to the veterinarian. The veterinarian writes a prescription for a medication. You're going to go out and you're not going to complain about the $70 antibiotic. You're not going to care so much about the $200 blood work. You're not even really going to care about the $10 or $1,200 surgery they're going to do to take care of Fido's knee. But God help you if you have to travel 30 minutes to see your doc, because after all, that's inconvenient, but I'll travel an hour and a half to see my hairdresser. The long and short of it is that people have confused priorities, but they don't take care of themselves. They don't hold themselves in, let's say, high enough regard. You're not worthy. And this is the thing that drives me crazy. When you're on an airliner, I was a flight surgeon at one point, and one of the things that we learned and what flight crew do commercially is they will tell the passengers, in case of cabin decompression, put your mask on first. Why? As a few seconds later, you're going to be passed out too. You and your kid, you and your whatever, you're all going to croak. Okay? So somebody has to be the adult here. And when it comes to taking care of your health, if you don't take care of yourself first, you're not going to be there to take care of Fido. You're not going to be there to take care of Whiskers the cat. It just isn't going to work that way. Now, it's long been known, okay, that when you write a prescription as a physician, fewer than one half of the prescriptions that go out ever get filled. Now, how was the government in its marvelous condescending way, how are they going to fix this problem? Well, they mandated in 2007, okay, that physicians go electronic on their prescriptions. Because if you send it straight to the pharmacy, of course the patient will go pick it up. Did it change compliance, is what we call this in medicine. It's a little bit condescending phraseology, I have to agree, but they call it compliance with instructions. The answer is no, it didn't make a lick's bit of difference. People will get the medication mailed to the mail order or automatically. Does it change the way they take it? The answer is no, because of the other 50% that do pick their medicine up, only half of them take it properly. So if you're taking 5 or 6 medications, what do you think that the statistical probability is that you're taking them all right, all properly, all as directed, all effectively? If you don't take care of yourself, you can't take care of your loved ones, you can't take care of your pets, your critters, or really anybody else. What good are you going to be scooping out the goo at the soup station for somebody else, okay, if you can't survive, if you can't breathe, if your heart isn't working properly? So what's led up to this? Why do we think, okay, that we're not worthy? Okay, and we could be at this all day long. It's a philosophical discussion. Why do we loathe ourselves, and why do we find it so difficult for ourselves just to like ourselves, to like what we're doing? Where is our self-esteem gone? Well, with girls, we can argue that they're taught at a young age that they're inadequate. Okay, so what do they have to do? They have to go out and enhance certain attributes. Now, as a dad of a daughter, I really wasn't crazy about when she went out to enhance her attributes. Okay, I found that to be rather bad. However, when it's other kids, it didn't bother me quite so much. And the women do the same thing. They try to measure themselves up against these women that are in these magazines. Now, I've had the opportunity of actually meeting, sometimes up close and personal, some of those gals in these magazine ads. Okay, and they're really not all that pretty until they put their makeup on hard, and then when the camera flattens out their features, they start to look pretty darn attractive. In person, maybe not so much. So even the reality of trying to measure up doesn't work. So the self-loathing comes from a sense of inadequacy and a sense of, I don't know, it's really... It's a shame. You're ashamed of yourself. You're ashamed of what you're doing. You know in your heart of hearts where your failures are, even if everybody else doesn't. And this translates into a bit of self-destructive behavior. Why are you not following instructions? Why did you start smoking to begin with? Why have you not stopped? Why are you still drinking too much? Why have you not stopped? The same thing goes with eating, but even taking your medications. Well, it's too much trouble to take these things twice a day. Honest to God, I tell this to my patients, feel blessed, okay? Because in most of the world, they cannot afford to have what's at your fingertips, okay? They would sell what they have in order to have enough money to buy these medications that you've got at your fingertips to take care of these problems that are entirely treatable. It's like diabetes, okay? This is a disease that, for the most part, is entirely preventable and entirely treatable without prescription medications. Okay, yet when given the instructions, when given the yellow brick road to health, the number of people that find it too much trouble is astronomical. And this is a daily struggle of mine. Okay, I go home and sit back and wonder whether I actually did any good at all. Because so much of what I try to explain to people, so much of what the passion is in trying to make people better, to make them more themselves, to make them healthier, is wasted because of a self-loathing, which is something that I don't know how to fix. I don't know how to address it. Where does happiness come from? Okay, where does satisfaction come from? And it actually comes from within. If you can't make yourself happy, nobody can. Okay, and I think it begins with the inability of people to find ways to make themselves satisfied. Why are you not satisfied with the fact that you are living in a home? It's dry. Okay, that just eliminated 60% of the world's population. You're not going to bed hungry. That eliminated 2/3 of the people that are left. Your kids have clothing on. And pretty soon you start counting all these blessings and you realize that you're in the top 1/10 of 1% in spite of the fact that you're not living in a mansion on the hill. It doesn't really make any difference. Relative to the rest of the world, you are blessed and you don't appreciate it. And I find that to be very, very sad indeed. I go home and I find happiness in what I do. And I would hope that you would also.
A lot of people are just plain lazy. They think that once you give them that prescription, that was their goal
and you're right.
in coming, was to have you give them a script.
Correct.
So they go to the pharmacy and they see the nice person and they get the script and they take it home.
Yeah.
Then, and I've been guilty of this, they don't even read the bottle.
Well, there is that.
Well, there was that. They don't read the bottle. They don't take the dosage correctly. And I do want you to do this, folks. Don't be lazy about this. If you want to know more about Dr. Klein, about his board certifications, about his qualifications, about how they can help you, about how many diagnoses they can do in their office that can't be done anywhere else, well, just go ahead and go to suffernomore.com, suffernomore.com. And once you're on nutraceuticals and you find yourself feeling so much better and you find your body is doing so much better, once you take those nutraceuticals, don't be lazy. Don't forget about them. The doctor has done 90% of the work in signing you up for stagesoflifevitamins.com, stagesoflifevitamins.com, and that will get you on a regimen of deliveries on time, every time, for every nutraceutical. Stagesoflifevitamins.com.